And one is taking a heat off.
West Virginia Citizen Action and West Virginia's Healthcare for America Now partners are very proud of Representative Rahall for standing up to the health insurance industry and other special interests in doing what's right for the people of West Virginia. His historic vote to pass health care legislation through the House means we are one step closer to having real health care reform in America. With his vote, Representative Rahall has said yes to lower health care costs, yes to guarantee of good, affordable coverage, yes to stopping health care insurance companies from denying care, and yes to the real choice and competition we'll get with a new national public health care insurance option. Thank you, Representative Rahall.
All of you have built such an effective coalition of concerned West Virginians that the victory is yours. Let me tell you that. You worked hard. You have worked at the grassroots level. You attended my town hall meetings and many other town hall meetings, whether they were by congressional people or regardless of who called those town hall meetings. And it was because of you that I think the opinion that was so set against health care back in August turned. It definitely turned in the ensuing months. The town hall meetings, I think, helped show the misperceptions that were out there, the misinformation that was out there. Sometimes people that did not want to hear the facts finally did hear the facts, and they were rather surprised to learn what truly was in the legislation, and especially with our new transparency rules and the fact that the bill was out there for the people to see for so many months. Although not the exact precise bill, but certainly the parameters of it were out there. This was probably the most debated bill, most open process, most transparent and accountable process of any piece of legislation in my 33 years I've had the honor, been very humbled to represent Southern West Virginia. So it was your victory, and I appreciate it very much. So many people that have worked hard. It has been, Perry Bryan, as you know, and we've met in my office not only this year, but for many years on this issue. It was, I think, the best we can do so far in providing affordable, accessible health care for our West Virginians that do not have it, and for so many countless Americans. This is a first step. There's a process in the other body, and I just left Senator Rockefeller, who, of course, extends his thanks to you as well, the real champion in the other body and an individual that knows this issue inside and out and has worked his heart out for decades. I regretted he had to get back to Washington, but certainly we have a process in place now that is moving forward. And I am very optimistic that we will have a bill on the President's desk by the end of this calendar year. Kenny mentioned everything that was in the bill, so, and certainly each of you know what was in the bill. And I believe, would I have liked to see a more robust public option? Yes, but like I said, this is a step in the right direction, and we're going there because I believe that's what's really necessary to provide the competition that the health insurance companies need in order to provide what's needed for the American people. Competition, what's wrong with that word? I thought that's what we were all about in this country. We have competition when we run for a political office. We have competition in about every product you can think of in this country, except health insurance. And the false charge that we're driving the private insurers out of business, just that, false. We're providing them an opportunity to make more money. More people are going to be out there for them to go after and seek their business. They just have to tailor a product, and they have to be competitive, and they have to provide the customer what he or she wants. What's wrong with that? Somewhere I'm missing something to those that criticize that. But, you know, we did something historic. That word has been used a number of times. Certainly the conditions of, or the pre-existing conditions that allowed so many people to be cut off insurance in the past, we've eliminated that possibility. We have eliminated the annual and lifetime caps that the insurance companies have placed upon individuals. We've provided for portability so that if you lose your job, you do not lose your insurance. We provided for the solvency, the Medicare fund that Perry has mentioned. We really have provided, I think, what has been long overdue. The status quo just totally unacceptable. Healthcare premiums going up. If you're covered today, God bless you. And that's even more reason why you should be for this bill, so as to prevent the rationing that the private insurance companies are doing that will allow them to cut you off for whatever their whim may be in the future, or raise your premiums, or raise your co-pays, and reduce your coverage. So those are fears out there that those who like what they have today would still be able to keep, and those who have insurance, they ought to be for this bill as much as those who do not have health insurance. So we are providing in this bill for those that are dying every day. Talk about pro-life. This is a pro-life bill from the get-go, because we're providing health insurance to those that are dying every day because they could not get health insurance, because they did not have it. Because they did not have the financial wherewithal to go and get that preventive checkup, or have a disease or a condition treated at an early stage, but rather had to wait till it was so debilitating that their life was truly in danger, and they faced catastrophic costs of treating at a late stage because they were afraid to go at an earlier stage, or could not afford to go at an earlier stage. So that's what we're doing in this legislation. We're providing the financial wherewithal for those who have not had that ability to pay for doctor visits or their medical treatments. Preventive measures are a very important part of this effort, and we voted to make health care affordable, not just for each and every one of the constituents I have the honor of representing, but for every person in this nation. We know that health care is an issue that crosses every economic and cultural boundary. Many of us have or will face a time in our lives when our health needs will outpace the means of our insurance. No American should live in fear that an illness could send them and their family into financial ruin, nor should they live in fear that they will face a choice between putting food on the table or getting their prescriptions filled. So ending the donut hole, although gradually, is a very important part of this legislation. We pay for it, as Kenny has mentioned, by providing I forgot the percentage, over 5%, I think, surtax on couples making over $1 million a year and individuals making over $500,000 a year. The same individuals, I think they made out all right under the previous administration. And so now we're just asking that they return a small part of that to help provide this insurance. So when you come right down to it, this bill should end the fears that the American people have. The fears of being financially ruined because of an illness. And it should bring an end to the moment when a diagnosis becomes a death sentence for those without health insurance. So again, I want to thank each of you for the work that you've done, and you know it better than I. There's still a process to go. There's still much work to do, and I'm sure that with Senator Byrd and Senator Rockefeller's support in the Senate, which I feel very confident we have, that we will see the day, as I said earlier, when the President of the United States will sign this historic piece of legislation into law. Thank you. Thank you.